So if we look at the data and think, okay, our biggest burden of disease right now is these diseases that are not caused by, I mean, they certainly have some portion that's due to genetics. I don't want to downplay that, but they're really increasing because of external factors. Okay, what are these external factors?
A critical component to mind control. Being made over to be clones of the person who's at the top of the pyramid. Interested in this subject because of my own cult involvement. I was recruited in 1974 into a front group of the Moonies.
Hello, I'm Dr. Stephen Hassan with another episode of my new podcast, Cult Conversations, the Influence Continuum with Dr. Steve Hassan. And I've been waiting to interview my next guest for months. Dr. Tracey Woodruff. I learned about you when I met and befriended Dr. Lustig and had him on and learned about your great work. And I reached out to your people and you're like, in a few months we can do it. So here we are, finally. I want to just give you a few more things about your background. You are a professor in the Department of Obstetrics, Gynecology, and Reproductive Services at the University of California, San Francisco, the director of the Program on Reproductive Health and the Environment, a world-recognized expert in research on understanding exposures to environmental chemicals, their effects on early development, and translating scientific findings to improve clinical care and health policy to prevent prenatal exposures to harmful chemicals. You're a senior scientist and policy advisor to the U.S. EPA Office of Policy. Is that still ongoing?
That was my previous job before coming to UCSF.
Okay, so previous job. And I want to just also mention you have a project at the University of California, San Francisco, for the Center to End Corporate Harm, Defending Science and Protecting Health, which I'm like, yes, this is so great. So welcome, Dr. Woodruff.
Well, thank you for having me. That's really great to be able to talk about our work.
Yeah, so my listeners know that I don't just talk about cults and brainwashing and mind control. I also want to shine a spotlight on good people who are doing solid research, who are truly experts, who truly care about the well-being of others in this age of misinformation and disinformation and anti-science and attack on experts. So the platform is yours. Please tell us more. Let us enter your world as you see it. We're recording it now, July of 2025. So things are happening.
Things are happening. And when you say enter the world is kind of vast that we're talking about, but maybe I will provide some context first.
Please.
To ground. Because I think as we're like walking through or working or experiencing what is happening in the federal government right now, we have to think about it in the context of particularly related to the Make America Healthy Again movement. And first of all, let me just say I am pro-vaccine. So I just want to...
Yeah, me too.
Right.
I have 5 COVID shots now. I'm elderly, so they tell me I needed another one after 6 months, so I got it. And so I am a believer in modern medicine. I'm also a cancer survivor. I'm also very, very in favor of Dr. Lustig's work about, the evils of sugar and how corporations have been, for profit and bad acting has been selling us stuff without any consideration for the harms.
Right.
Back to you.
Yeah. No, so I think this really speaks to, and we're pro-vaccine, and I understand why people are concerned about the growing burden of chronic disease in the population, particularly among children, right? Children, I've been working on what affects children's health for a long time. And when actually I was at EPA, we were the first to produce a report that follows children's environmental health trends, like are children getting sicker or are they getting healthier? And unfortunately, as this administration actually has also promoted, is that children are not as healthy as they used to be 20 to 30 years ago. And even when you look at the burden of chronic disease globally, there's been a big shift between the 1990s and today, which it was in the 1990s, communicable diseases. So those are things like malaria or typhoid, where that was the burden. That was the biggest burden of disease, particularly for contributing to mortality. So it was like almost 50%. And since 1990 to today, it has shifted. So now the biggest burden of disease is non-communicable diseases. And I know that word is like, it's very technical, so I'm going to break it down. So those are diseases, that things you don't get from a traditional, from contaminated water or a mosquito or something like that. So it's like cardiovascular disease, cancer, diabetes, obesity. So we're seeing this profound shift in the population. It's not due to genetics, right? This is due to exogenous factors that are influencing our health. And we get a lot of NIH funding, so yay NIH. But to be fair, NIH has spent a lot on genetics and not a lot on the endogenous factors.
Yeah, Dr. Lustig explained that there was this focus on genetics and missing out on the environment. And of course, for those of us with social psychology background, we're overcoming that cognitive bias to look at environment and social influences, right?
Right. So if we look at the data and think, okay, our biggest burden of disease right now is these diseases that are not caused by, they certainly have some portion that's due to genetics. I don't want to downplay that, but they're really increasing because of external factors. Okay, what are these external factors? Well, it turns out that, and this is some estimates from data that's been published, and I feel like it's an underestimate, but a third of the deaths globally are due to essentially 5 commercial products: tobacco, alcohol, sugar and ultra-processed food, chemicals, and then fossil fuel industry, particularly as it contributes to air pollution. So they're not products that just happen to exist they're not natural products like a mosquito. Right. They're made by corporations. So if you move up the stream, you have corporations are making these health harming products, and we are seeing the result of that playing out in the health of our population. So
can I
ask? Oh yeah, you can stop.
Forgive me.
No, go
plastics and microplastics are part of the petroleum industry. And so I would like you to just comment on that. And then Teflon and PFAS and forever chemicals, please.
Right. All the chemicals. So, yes, one of the things that's really, and that's where we do our research, is we look at the role of these manufactured chemicals, industrial chemicals that are used in all our products, to which we are exposed and which influence our health. And so you gave an example of PFAS. PFAS are these perfluorinated chemicals that are basically used in Teflon, nonstick fabrics, materials, like your Gore-Tex parka or something like that. And they've been manufactured and promoted by DuPont and 3M, for example, since the 1950s, basically post-World War II. And this is where we have the intersection with the work that we're doing about corporate influence. These corporations knew for decades that these PFAS chemicals were harmful, and yet they were putting them out into the environment. They're putting them into the products. They were dumping them in the water. In fact, the only reason we know so much now about them is because a lawyer, Rob Bilott, took up a case to sue DuPont over basically the dumping they had done of PFAS in a community in West Virginia. And so what we found was that they knew and they didn't tell us.
Yeah, there's a whole documentary I watched.
A whole documentary, yes.
We'll put the link in the blog for those who haven't seen it, with all the dying cattle who were drinking the polluted water from where the chemicals were being dumped. And he's like, this is not normal.
No, it is not normal. And so now there's like 12,000 of these PFAS chemicals. There's a little bit of regulation on them, but the underlying problem with this is that chemicals like PFAS, like plastic related chemicals, are, for those that have existed on the marketplace since the 1970s, that's like a technical component, which is 40,000. They're largely, we have no idea what their health effects are. We don't know where they're used. And that's because the laws in this country are set up to favor the chemical industry, and that EPA is forced to get the data and go one by one and then defend every decision about each chemical. That law was updated in 2016 and 20 chemicals have been assessed, and there's 40,000. So,
right.
Yeah,
So,
that's a lot more.
Yeah. And can I ask, I just saw something and I was like, huh? But I heard that gliding floss has PFAS in it. Is that true? Because I've been using that because I want good, healthy gums and wasn't even thinking that there might be PFAS in my floss.
Yeah, that was, yes, there was, I think it was an environmental group looked at the PFAS in dental floss, which has also been documented. And that's the other challenge, is that the chemical industry, even prior to 2016, EPA, under the law that it's called the Toxic Substances Control Act, TSCA, EPA they couldn't even regulate asbestos because the law was set up to favor the chemical industry. And now it's been slightly updated, but as you can see, chemicals that haven't been addressed can be used in any product and self-regulated or not. So yes, it's in dental floss. We're always finding where it is. Just to get back to your, also the thing about plastic. So yes,
please,
plastics. I mean, everyone knows what plastics are. And the thing is,
but a lot of people don't realize it's from petroleum plastics.
Right.
You know?
They are made almost 100% from what's coal, but now natural gas. So essentially the advent of fracking in the United States has led to a large increase in the production of plastic. So we have twice as much plastic produced since 2008. And the plastic industry is projected to triple by 2060. And what that means is there's a lot of chemicals made from, basically, the fossil fuel industry is looking at plastics as a way to make money. Right? They use it. They want to produce more plastic because, people are using, well, up until this year, there was less. A lot of the industry, like cars, were switching to electric. Home heating was switching to electric in order to address global warming. But now, so the fossil fuel industry is like, well, what are we going to do with all this excess capacity that we've been drilling from the ground? Plastics. Right. Anyway, so plastics are like they're a challenge because they get out and about. You can't really recycle them. That is mostly, they're recycled. Some very small portion is recycled into fleece or something. But the vast majority is not recycled. The single-use plastic gets out and about. They break down in the environment and they not only have toxic chemicals in the plastic, but there's also these microplastics. Those are like little tiny plastic that some of them you can see, but some of them are even smaller. And now we know that microplastics are everywhere. There's just a study that came out in Nature yesterday saying that not only are there microplastics in the ocean, but the even smaller, the nanoplastics, which take a different kind of technology to measure. There's even more nanoplastics in the ocean than there are microplastics that we didn't even know about because we hadn't actually studied them. And then we get exposed to microplastics. So now we know that microplastics are found in every part that has been measured in the body. So like blood, feces, breast milk, brain. So we're basically carrying around a load of microplastics, and that means that can influence our health. So that's one of the groups of chemicals that we're looking at, and these other health harming products that are contributing to this growing burden of chronic disease, and the fact that the fossil fuel industry, the tobacco industry, the sugar industry, the opioid industry, they've all contributed to essentially a health crisis in the United States. And so we as scientists have to think about, well, if we're going to, we study health. we look at things that increase risk to health, and then we look at the risk factors, and then we look at mechanisms to prevent those risk factors. Right. So we have to treat corporate produced products and the corporations that are producing their products as another risk factor of disease to study, evaluate, and provide intervention recommendations. And we can know a lot about this from the experience with tobacco, which has been well studied since the 90s. So
Right. And I'll just add a little factoid, if I may. We're just meeting each other for the first time, but I got interested in the whole subject of undue influence because I got into the Moonies when I was a college student in the 70s and experienced the radicalization. My former cult, the Moonies, own the Washington Times newspaper.
Oh, right. That's right.
And they are been the largest climate science denier disinformation vehicle for 50 years, according to the Parrot and the Igloo. I want to say David Lipsky's book was about climate science denial. So there's a link of propaganda and disinformation deliberately to make money and keep doing things and to try to avoid, in lawsuits, there's no causality between our product and when they did their own studies and they knew there was, right?
Yes, I think this is what makes this work very important. So, and you and I are talking about it from maybe our own personal experience, but I want to say that a lot of this research is also grounded in actual documents that come from the industry. So we can actually see in their own words. So it's not like us saying, oh, I think the tobacco industry is doing this.
Right.
We can actually see in their own words what they actually were doing. So I think that the UCSF is home to the largest collection of internal industry documents in the world. And that provides insights and really a mechanism for us to do research on what did the industry know? When did they know it? What did they do to change both the regulatory and policy process? How did they influence public discourse and communication about their products? And it's been it started with tobacco. That was the first set of collections. And then the library collections have been slowly expanding to add other industries. And what's really important about this, like you were saying, is they collaborate. They collaborate through either similar front groups. They collaborate through common lobbyists who work for them. They collaborate through, marketing camp groups. So you can actually see how they share strategies across their different industries to promote their bottom line, and they are about making money. That is, it's all about making money over the, independent of what their products do.
Yeah, so you're in Northern California, a blue state, and an organization that I love, the Electronic Frontier Foundation, is based in San Francisco area. And they look at technology what the owners of these big platforms have discovered about how to use personal data to micro-target, to capture our attention and make people addicted. And now they're playing with emotional, affective, artificial tools that make young people fall in love with bots. And there was I interviewed an attorney who is representing the family of a 13-year-old who killed himself to be with his character AI love of his life. And so there's that, again, the same theme of corporations that want money and power, that don't really care about human rights, rule of law. Would they want their own children to be using their products? I remember the Social Dilemma documentary that the Center for Humane Technology did, where all of these social media people wouldn't let their own children on it, but there they are making money. And it's so sad. It's so sad.
Yeah, it is terrible. And I just brings me back to people's frustration. Yes, I do live in San Francisco, in California, but I know from people in my own family who live in areas who are not so fortunate to have the kind of resources that we have in San Francisco and in the Bay Area. I don't live in San Francisco, but in California, who live in areas, even in California, that have been neglected and left behind and impacted by like the opioid epidemic. The opioid, right? I mean, let's talk about something that's really hit rural America very hard, the opioid industry. And now, because of the lawsuits and the documents that we have, we can show the many different ways that the drug manufacturers manipulated and promoted their product to vulnerable people. I mean, there's a researcher at UCSF. So UCSF is, as I said, we have the industry documents library. We are now adding millions of documents from the opioid settlement cases. Kelly Knight is doing research on this in collaboration with Johns Hopkins. I mean, even some small tidbits are like they hired school nurses to promote opioid to kids for injuries. I mean, and then they marketed opioids to pregnant women for harm. I mean, it's insidious. Disgusting. It's disgusting. So
it really is.
So I just think that this issue really cuts across all of the United States. People are mad. And the world. People are mad, and I get why they're mad, because it is so frustrating. And the government has not done everything they should, in part because they're captured by corporations. Now, will this government do that? No, I don't think so. I mean, they're already dismantling EPA, so they can't actually. And they have made it quite clear that they would, they want to promote the very industries that have been producing these health-harming products. But it does speak, the MAHA movement does speak to people's frustration with what the status quo is in terms of dealing with these, being essentially assaulted by these products that are made by corporations, and they feel frustrated that they can't do anything about it.
Right. So the MAHA, Make America Healthy Again movement was supposedly going to be championed by RFK. And
well, he does champion it. That is true.
Well, he says he's the champion of it, but in fact, he's not. I mean, I just read something recently about him promoting an ultra-processed food company, even though he said we want to go against the ultra-processed food stuff. He is not doing what he should regarding vaccinations. And I was just reading this morning, we have more measles cases than ever before. So we're back to communicable diseases.
Yes, maybe we'll have both. Yeah, it's terrible. The measles situation is so sad. I mean, it's terrible. It's tragic that people had to die when they did not. Children died. I actually saw the FDA commissioner have a clip on his Fox News or something saying, well, I just want everyone to know that the mortality rate for measles is very low. And I'm like, it could be zero.
Right. Yeah, but they're long-term health problems, right? So this is going to be a burden on our healthcare system too, not to mention the pain and suffering.
I know. It's really, it's very sad.
And I've heard that it's only a matter of time before we have another pandemic, whether it's bird flu or something else, and we're dismantling all of the top experts and scientists who this is their expertise. And I just want to say from my research with the cult of Trump, I learned about something called fourth generation psychological warfare that was first written about in the 80s by American military strategist William Lind, L-I-N-D, who met with Donald Trump. But this was a deliberate, and Michael Flynn was involved with this, I should add. This was a way to undo other governments around the world. It was attacking experts and science and democratic institutions to destabilize them so there could be a regime change. Except that William Lynn paired up with Paul Weyrich of the Christian Right and have been doing it on Americans since the 80s.
80s? Does it go back a little bit before that? But yes, yes.
But we know from him specifically, and this idea that we can't trust experts, we can't trust science. Well, if you're a Christian nationalist saying that the world is 6,000 years old because the Bible says so, if you're a fossil fuel corporation, you don't want global warming to be scientific and provable, right? So there was a whole agenda behind this psychological warfare. But I want people to come back to sanity because they want chaos and get people to not trust experts and science.
Right.
Please.
And I think that's a really excellent point. And if they have been, if you look at Project 2025, which is the blueprint for the administration that was written by the Competitive Enterprise Institute or American.
And Opus Dei was the Heritage Foundation project.
For Heritage Foundation, right. That has actually been an update of a document that existed all the way back to the Reagan administration, 1980. So they have had a long-term strategy. But I do want to say that we also have to take responsibility for, being honest and acknowledge what the science says. I think that for sure, they have been attacking science and expert credibility and that kind of thing, and those kind of components.
Yeah.
And the government, it's very hard for the government to talk about, here's what we know, here's how it evolves, here's, we didn't know that before, now we're going to do something, in part because they get attacked a lot. But I think because there's been a lack of acknowledgement of how the government have not really addressed some of these issues that have been raised, like ultra-processed food, contaminants in food, toxic chemicals, that this has also contributed to people's lack of trust in the government. Now that has been exploited, but I think we as scientists need to acknowledge, what the actual data say.
Yeah, it's not all or nothing, and it's not just Republican or Democrats, because there have been Democratic administrations that have done real harm.
Yes.
And undermine democracies around the world that were elected. But I'm always focused, Tracey. I might call you Dr. Woodruff, Tracey.
Oh, you can call me Tracey.
Yeah,
please.
Thank you. Call me Steve. But I'm a therapist by training, and I'm constantly needing to tell people, look, we have to be in our bodies, in the here and now,
right?
Thinking about what's within our control, and with a positive future orientation that keeps us going, and we can spend a lot of time reliving trauma from the past or mistakes that were done by others, or worrying about things that haven't happened yet. But really, the optimal functioning for our brains is to kind of be like, let's be in the here and now and think, what can I do today? What can I do this week? What can we plan to do in the next year to move the humanity towards longer survival and, to the health of the planet? And there's so many brilliant people with great ideas, and they're not surfacing the way they could or should. And there's just been an overemphasis on greed and that somehow you're a better person if you have more money versus doing work that actually is saving lives and helping children, like your work.
Yeah, I agree with you. And I do agree that it's just like now we are in really a crisis mode in terms of our both, and I'm just going to speak from the health side, we have this growing health problem, and the government is actively undermining people's ability to address their health. And we could talk about Medicaid, but Medicare, that Medicaid, that cuts that will really affect people, but
Sure.
they're already behind because of their inability to access healthy products, healthy food, healthy
Right.
environments that this administration has already identified that they are going to undermine. So I think that you are right about that. We need to be focused on what can we do now. So
Right. And I really want to say to my listeners, you need to find trustworthy sources of information regarding healthcare and not trust social media or AI generated stories that haven't been fact checked. Like, you really need to be careful. And we need more people with track records of excellence and dedication to the scientific method, which is evidence-based, but also depending on peer review by our communities to make sure we're getting it right.
yes, I agree. And I think the other thing we need to identify as an influence on the scientific process is the funding of research.
Yes.
So because you say experts, how do people know? Because let me rephrase it, scientists who are publishing, some of them get all their money from public sources, and that's great. But you have to be careful. And Lisa Barrow, who's a colleague of mine, is part of the center, has tips for identifying industry influence on the research, because we know from empirical research, both in the tobacco documents, pharmaceutical, chemicals, that funding source, so corporate funding, financially conflicted sources of funding, produced biased science.
Right.
So when people are looking to make sure that they have an expert and the science that is legitimate, you also need to ensure that they're not being funded by the corporations who are producing these health harming products.
Yeah, I'm so glad you mentioned that. And in my world and yours, we're supposed to disclose our conflicts of interest and our sources of funding, but these bad actors have front groups that sound legitimate, and they are able to often hire legitimate front people to give it an apparent air of scientific credibility. And that's why we really need a fully informed, independent, journalistic, institution that will shine a light on bad actors. And people ultimately will need to be held accountable. And right now, we can't look to the government to hold criminals accountable when they're letting criminals out and doing criminal acts on American public. So doesn't mean it's always going to be that way, but we have to have a vision and a clarity of our values, because it can, about the science of nudging, right? That if you can get a little shift, you go another shift. And so with micro-targeting and AI algorithms, my understanding is that Russia and China and other bad actors, Christian nationalists, are wanting the left and the right to get more polarized, so people distrust each other instead of building the coalitions that are going to be needed to upend this takeover of what's happening to destroy our democratic institutions.
Right. Right. And I think this is why the work that we're doing is so important, because people care about their health. They care about their children's health. They know that corporations are, they're motivated to promote their profit line, and that they can't be trusted in terms of doing right by people's health. We did some public opinion surveys maybe 2 years ago, and we talked to people who are blue collar workers, moms, younger generations, older. People uniformly agree that they don't want, in our field, toxic chemicals, and I'm sure it's true with ultra processed food. They don't want to have that in their lives. They want the government to do better, and they don't want corporations. They know that corporations are not being honest about their products, and that they don't want them to be adversely influencing the government, their access, their
Right.
health.
Right. Exactly. So I can't not ask you about women's health and reproductive health with this assault on women's rights to have control over their own bodies and their own health care. So I want to give you a platform to speak about this horrible move backwards in terms of women's rights.
Yes, the one thing women or people should be able to control their bodies and their health. And a lot of this, a lot of the focus on the rollback is around access to your choice to end your pregnancy, should that not be the health trajectory you want to go upon.
Right.
And I think that this gets to that women should be able to decide whether they're going to have a healthy, safe pregnancy for themselves. Because sometimes people are like, well, you're talking about toxic chemicals, and we know that pregnant women are exposed to multiple different toxic chemicals all at the same time, and that it goes through the placenta, the fetus is exposed, the baby is born already exposed to all these different toxic chemicals, which we know can adversely influence health. And so, sometimes this argument is used against us in the abortion debate, but it's like, no, people should be able to choose how they should be able to choose not to be exposed to toxic chemicals. They should be able to choose to deal with the health care that they need in their situation, which it could include terminating a pregnancy because it's not for their own health, for their own long-term health, depending on their circumstances. So it's really disturbing to see many of these states not only trying to control women's bodies, but then trying to control the capacity of other states who have affirmed the right of women to be able to control their own health, to try and stop them from doing that. That is, well, I mean, it's to be expected, but it's really hypocritical when they talk about states' rights as just an underlying theme there. And I also want to say one more thing about women's health or couples' health or fertility. And I think this is where I think the mainstream media has not really heard the concerns of the public about the health crisis and the fact that a lot of these ultra-processed food, toxic chemicals, et cetera, are impacting their health. So let's just talk about the New York Times and their coverage on fertility and the declining population, which, to be fair, they've started to change it a little bit. But in the beginning, it was all about, well, it's because women are choosing to have a job. And it was almost like it was our fault, right? Women are choosing to have a job. They're waiting later to have babies. It costs money, which is true. That is, it is very, the United States could do something about the cost of having children in the United States. Yep. And so it was all about women and their choices. And that was what was contributing to the fertility crisis, not the fact that there's this increasing exposure to these many toxic chemicals, which we know impact fertility. Now, is that the portion of the decline in fertility in the United States? I mean, there's more to learn there. But you have to acknowledge the role that there is a lot of women or couples who want to get pregnant and they can't. And why is that? That's not because they have a job they like.
Right. And the whole assault on IVF. And,
yes. Right. I mean, they're going to move upstream, right? Once the abortion thing, right? You have these states that have banned abortion, and now they're going to, right? One of the states wanted to go after embryos, fertilized embryos. It's just, and that would, now it's very interesting because you have the crisis of, I can't get pregnant because I want to, meeting the pushback on, we want to control all the aspects of your reproduction. for the moment, people who want to have a child, should they choose to, have prevailed in those states, right? They carved out IVF as it's okay to still have embryos and we're not going to destroy them all. But, there's a movement to counteract that. I just want to say, I just like the abortion thing. That was a 30-year, how long did that, when was Roe? I was like 30 or 40 years that they worked on this.
Yeah, I thought it was 50. And all the Supreme Court justices that voted against Roe v. Wade said it's established law. Of course, we're not going to change it. And they lied their faces off because they were recruited by Opus Dei and the Federalist Society. And that was one of the long-term agendas, is attack gay rights, attack women's rights to choose, and make America a Christian nation, like abolish the separation of church and state. But, for me, I want to believe in the goodness of people, that most people are kind and good, and most people love their children and their grandchildren and want to have a healthy life and for their preservation and such, and to cut through the noise of all of the psychological warfare stuff that's coming at us from the administration. I want to go back to RFK.
Sure. I don't know him, by the way, so everything I say is speculation based on what I've read.
Yeah, just speculate, but also I'd like you to focus on, if you were there, what would the priorities be? And I want people to not just hear critical things about what he is or is not doing, but what we really need in 2025 going forward.
Okay, so actually, we have put together, this was really more for EPA, but we have actually, just I'm going to go back a little bit. What you were saying is that for the abortion movement, they had a 50-year plan and different strategies that they worked on to promote their goals. And our challenge is, what is our plan? What are the things we want to see the government do? Should we have a government that is truly responsive to people and is actually thinking about their health, and not the fact that they get a lot of input from let me restate that. That get a lot of input from corporations that want to influence the government to be favorable to them. Mm-hmm. So I will share those resources on our website. But I want to say for RFK, I very much appreciate that this has opened the conversation about the role of other factors that influence children's health. It has also affirmed that the government cares about children, that they acknowledge that children's health that there's more chronic health conditions in children than there were before, and that the role of these ultra-processed food. And we could talk about over medication. I mean, there's some, not vaccination, but other components, and then toxic chemicals. Yeah. And actually, I think technology's in there too. There's 4 things in the MAHA report, right? And now I've been reading the MAHA report and annotating it, and I acknowledge there's references that their references are not up to the gold standard science that they say. But I think we should look at the overall point, which is, they say there's toxic chemicals. They talk about cumulative exposures to children's health. They talk about why we don't do enough about addressing cumulative risk. Yes, and they talk about corporate influence on science. I have never seen a government report that says corporations are influencing science. Now, do they go far enough and say all the right things? We can quibble about that for sure. But think about it. The government says that corporations are influencing science. We should take that and we should affirm that and move forward to what we need to do. So my recommendations for what I think they should be doing, and I don't think they will do this because, they're also busy dismantling EPA. So that would not fulfill their mission of improving children's health. So first of all, I think that NIH itself has done a very large investment in genetics. and I can say this with as being a NIH recipient and working with UCSF is probably is the number one in many years of NIH funding. So I'm very familiar with the kinds of things they fund. And it's a lot about genetics. And it's
Yep.
been interesting as they like map the genome. And then they're like, well, that didn't really answer the question about these chronic diseases. They're like, well, maybe it's, the proteome, or maybe it's the metabolome, or maybe it's the microbiome. So it's always the internal component. And what really NIH needs to shift, that they've got a lot invested in that. So now we need to shift to the external component. So I would essentially I would take whatever they were spending on genetics, spend on these external factors: ultra processed food, toxic chemicals. I mean, you could even do screen time. You could actually fund on how corporations, they do this in CDC. They have actually a tobacco control research program where they look at how tobacco industry influences science. And then whatever they were spending on environment before, they could spend on genetics. Like let's like just shift it all and see how it goes for 5 years. And you know what I have, my hypothesis is that we would learn a lot from this. And I can say this because from my experiences, we were part of the NIH Environmental Influences on Child Health Outcomes, which NIH ECHO Consortium, which is a 100,000 parent, mother-child, abandoned fathers cohort, a synthetic cohort of different locations across the United States, recruiting pregnant women and children. And when we were first in it, I was in charge of helping them prioritize what should we measure in terms of toxic chemicals, because you can measure different types of chemicals in the body. And to place this, there's about 300 that are measured compared to 40,000, right? Or there's 1 million chemicals or 1.5 million chemicals on the EPA inventory. Right. So we're like, how do we expand this and actually start to learn more? So we recommended a whole new suite of toxic chemicals based on which are the ones that we think could influence, for example, brain development. So we expanded the list to look at these newer flame retardants that have been measured, that have been identified. We thought that they would be important. We have data to suggest they can affect brain development. We added this in. We looked across thousands of chemicals. And you know what we found is that some of these were linked to autism. So I'm saying that is a very small example of how we could be really identifying better what's going on with children's health. So,
I'm glad you brought up the autism issue, because that is, I've been wondering how much the digital environment is affecting this feature myself, because if you have secure attachment, you're with your primary caregivers, listening to hearts, you're picking up your brain is getting pruned with human interaction versus putting the kid in front of a TV or giving them an iPad, and they're missing all of that robust human.
Well, maybe that should be a study too that they should fund. So
that's just my hypothesis.
Right. We have a lot of hypotheses. And I just want to say that it is really not, it is not useful and inaccurate for some of these scientists to come back and say autism changes are all just about diagnosis. That is sure. Some of the increase is about that, but some of the increase is real. CDC has been looking at 8 sites across the United States for 15, 20 years using the same diagnostic criteria and evaluating how many of those kids have autism. And there has been a real increase in autism and attention deficit hyperactivity disorder. And for experts to continue to question that and not talk about what parents are experiencing, this is going to keep us from fully realizing our ability to address what is a legitimate issue. Now, does RFK's statement about autistic kids will never have capacity to do many things that neurotypical people do? That is, of course, not accurate.
Right.
But he does give legitimacy to people who truly are concerned about looking at other factors besides genetics. I mean, on the other end of the spectrum, let's talk about Parkinson's.
Yes.
Parkinson's has gone up dramatically. Very small portion of Parkinson's is due to genetics. The government should be investing in my dream world where they shift the ratio of genetics to non-genetics to be opposite. Right. Parkinson's is a perfect area of investment where so many more people, I know so many people that have Parkinson's. I am sure that your listeners know people that have Parkinson's. Yeah. And think about that. Did they know that many people? 20, 30, I don't know how old your listeners are. Maybe they're as old as us, but maybe they're younger. Anyway, I just think it's like, these are the kinds of questions that people want to know the answers to. I would recommend that RFK do this. And then I would recommend the government follow up with actual regulations. I mean, the thing about I want to talk about the food dyes for a minute because it's really super interesting. Yes, maybe you have an opinion about them. So the state of California actually did a report on these food dyes. Actually, I want to talk about one of these food dyes. There is actually, so when you talk about quality science, a high quality study would be a randomized controlled clinical trial where it's blinded. You give one group of participants whatever the item is, and then somebody doesn't get it and they don't know who gets it. There's RCTs on some of these food dyes showing that kids who get, I think it's the blue one, they have higher symptoms of ADHD. And I remember it might have been the Obama administration, I was at a meeting and there was somebody who said, I was on the panel where FDA was considering this blue food dye and what to do about it. And it was so hard because we knew there was something going on with this blue food dye. And we knew that it could aggravate, hyperactivity in children. But FDA didn't consider it adverse, so we didn't do anything about it. Now, if you're a parent, and I can speak from experience, that is a problem. And so the fact that because really the food industry didn't want to change the food dye. The state of California did a report several years ago that identified that these food dyes could increase these types of behavioral aspects in children. So to say the state of California did this, and then this took off as an issue. Now, is food dyes the most important thing to regulate in food? I don't know, maybe not. But the fact is we have data on it. And the last government basically said, well, I had to regulate red food dye because it gave cancer to a rat, but humans shouldn't worry. That is not the language we need to hear. What we need to hear is, yes, we already have an authoritative body who said that these are a problem. We should look at ways to get them out of the food supply. And the only way to get them out of the food supply is regulation. Voluntary programs have been shown through studies not to work. And I guess M&M said they weren't going to change it. So there you go. But
I was going to say candies and cakes is what comes to mind with blue colors. It's like not a normal food coloring.
Oh, but think about it. There's actually one of those food dyes is in pickles. Yellow.
It is?
Yes, I know. See, I've learned something every day about this. I was talking to someone and they're like, oh, they dye pickles. And I'm like, why? It's already but yeah, some of the pickles have this yellow food dye, which is on the list that they've been looking at in terms of.
Yeah.
I know you sound crazy when you talk about this stuff too much, but
no, you're a scientist, you're a consumer, you're a mom. So I mean I
think the point is that we as scientists are also learning because we have been not told the truth. And so it's always, that's not the way the system should be set up.
Right. I have another question to ask you, Doc. Electronic magnetic frequency stuff.
I have my plug.
Yeah, I've talked to like Nita Farahani is a lawyer who talked about cognitive security, but I've interviewed someone recently and I've watched a documentary, I think it's called Generation Zapped, about how iPhones say don't listen with it next to your head or don't keep it, in your bra because it's emitting radiation. What sayeth thou? Any thoughts
Well,
other than we need to research it?
yeah, let me just say a couple things about this. I'm not a super expert in this, so I just want to caveat
Sure.
this. There have been I would say though, the National Toxicology Program under the National Institute for Environmental Health Sciences did do a study with rats. And I actually talked to the guy who set it up, and it was super interesting because they had to figure out this way to get these rats in a cage, and how do you get the cell phone radiation, and it was
Yep.
very, and they found that it could, there's some potential to increase risk of cancer. So that to me is like, independent of all the other studies, that's a concern, right? Now I know IARC has been on the fence on this. I think the thing there's a couple things. One is you have this rat study. Two is any kinds of study evaluations should very carefully look at who is funding the studies. Because as I said, funding of studies by cell phone industry will bias that science. And so if the review does not account for that, then it is not a high quality review. And then lastly, let's just say it's just about the rat study. You can there's ways to engineer these phones to make it so that they are not, or at least they can do the research. They have so much money. Why can they not do the research to make sure that they are not, there's mechanisms by which it does not emit this into your head? That would be my take on this. That would be my recommendation. Is like, even if we have a signal that still needs to have more research, and I'm always a fan of more research, but I'm also a fan of like, the more research you do, it's the longer the time before you can take the action. If we already have a signal, like that was a pun. If we already have a signal, we should just, move to do something. I mean, the Environmental Working Group worked on this, well, I want to say it's like 5 to 10 years ago in the state of California. And they just wanted to have cell phones labeled like, this cell phone has these different components and the cell phone industry fought them very hard. And I don't think it was very successful. So again, it's like, we need to have transparency and forcing of the industry to make sure that their products are not harmful before that we are exposed to them.
Right. And there's so many structural hurdles, and the tech companies don't want to do the research because if they find out it's harmful, then they could be held liable for proceeding without protecting the public. So let's just close our eyes and hope that it's okay.
Or not tell anybody about our research. I mean, there's a lot they could have research that we just don't know about also. Yeah.
I just saw a piece about some Exxon officials privately talking about this horrible flood that just happened in Texas, and how, we're going to be seeing more and more extreme weather events. Like, what are we going to do about it with our messaging that there's no such thing as global climate warming or crisis, and climate change. And, for me, I believed it in the 70s. I didn't need convincing.
You didn't even need to believe it because there was data back then.
Yeah, exactly. Yeah, exactly. And 98% of all climate scientists of the world agree. There's overwhelming evidence. And then there's a few paid people who say we need more time for more research because it's not conclusive. And it's like, excuse me.
Yeah, I know. It's very unfortunate that we were paying the price with people dying. That's not the only extreme weather event that's happened this year either. So it's terrible.
Yeah, so Dr. Tracey Woodruff, you are the professor in the Department of Obstetrics, Gynecology, Reproductive Services at the University of California, San Francisco, and the director of the Program on Reproductive Health and the Environment, a world-recognized expert on research on understanding exposures to environmental chemicals, just for people who may have missed the very beginning intro. And you explained to me that University of California, San Francisco has the largest single database for corporate information. There's a Center to End Corporate Harm, Defending Science, Protecting Health. So for young activists wanting to do something noble and help society, looking for your lane, it sounds like that would be a great place to pick a project and look for funding. Maybe we need to appeal to more private foundations for funding, or billionaires to get funding if the government isn't going to fund it. And we're seeing this trend now with the EU saying, "Come to us if your grants are getting cut. Come over." And it's such a tragedy, because I know so many really brilliant people who've been doing incredible research, and their fundings are getting cut. It's a tragedy.
Yeah, that's
Last
terrible.
words are yours.
I'm going to say people are concerned about their health. We are concerned about people's health. And it is a growing crisis that the illnesses that are increasing in the United States and globally, and that we need to be looking at more comprehensively at how these corporations produce these health harming products and how they manipulate the process from science to the regulatory process to miscommunication in order to promote harmful products, corporate profits over health. And that it is really important for us to work together to ensure that the government is enacting the kinds of policies and laws that will protect us from these corporations and their health harming products. And I really want to thank you for having me today. It was pretty fun. I mean, it was really fun. Not pretty fun. It was actually fun.
Well, I really want people to meet people who are real experts, who know what they're talking about. Robert Lustig explained to me about NIH and their overemphasis on genetics and missing the obvious, which is all of the corporations and environmental influences. So you just reinforced that whole theme. And I'll just say, the big pharma wants to push drugs to reduce obesity, and stop eating sugar. You'll feel better. He really changed my eating habits through reading his work and following him, because I want to be healthy.
Right. I just want to say the other thing that we didn't really touch on that I think is really important is that I know there's a lot of course, we all make choices in our life, but sometimes those choices are constrained by our environmental surroundings. And you and I don't know, where do you live?
I live in Massachusetts at the moment.
Okay, well, we, happen to live in places that have access to a lot of fresh fruits and vegetables, but a lot of people don't. And a lot of people don't have access to clean, healthy air. And that's why the government's role is so important, because you can make choices in your life, but a lot of choices are being dictated now by your environmental circumstances that are currently highly controlled by corporate influences.
Yep. Thank you so much for your good work. And
thank you.
Let's stay in touch, and continued success. Stay safe.
All right. You too.
Okay.